Hi everyone, welcome to week 2 of your Pharmacology 1 course. This week we're going to be covering chapter 3, which is all about drug forms. And as you, I'm sure have figured out by now, I'm going to basically just kind of go over some of the highlights of these PowerPoints. I'm not going to go through every single slide with you, but I am providing you all of the slides in addition to my audio lecture so that you have something to refer to. But this is just kind of a brief overview of some of the highlights, things I want you to make sure that you pay special attention to. So in this particular chapter, we're going to be looking at drug forms. And so what we're talking about here is the way that drugs are manufactured. So there's different types of manufacturing processes. You're going to be looking at things like the different types of tablets, the different types of capsules, solutions, suspensions, things that are even a little different, pellets, beads, wafers. Those are all different kinds of forms that you may not be familiar with. In addition to that, there's some different words and phrases that you're going to be expected to learn in this chapter as well. But one thing I want you to point out right away is that the FDA kind of regulates these types of things. So a drug has to get approval by the FDA in order to be publicly sold. And in that approval, they have to state what form that drug's going to be manufactured in. So if you say you're going to be, making it into a tablet, you can't all of a sudden make it into a solution and expect to be approved by the FDA. They'll only approve what you asked for. We have these different forms, however, because different routes of administration are more appropriate for different types of patients. For example, we know our pediatric patients are not going to be able to swallow tablets or capsules. So, solutions and suspensions are going to be more appropriate for that group. So that's some of the different things that we have to keep in mind. The first drug form that they talk about in your chapter is a tablet. A tablet is a solid. It includes both active ingredients and what we call inert ingredients. Those inert ingredients could be binders, things that actually hold that tablet together. Here's an example of an over-the-counter tablet, Zantac, and you can see that particular tablet is, they can come in a variety of different colors and shapes and things like that. The next form, hang on one second. Yep. In addition to just having a tablet, the tablets can come in different forms. So we can have a scored tablet. A scored tablet is going to look something like this, where it's got the line, where you can actually cut it into pieces. We've got effervescent tablets. Effervescent it's going to dissolve and bubble. Think of Alka-Seltzer. That's an effervescent type of tablet. Enteric coated. Enteric coated is going to have a type of coating on it that makes swallowing easier, things like that. Slow release tablets are made in such a manner where they won't release all at one time. Caplets are going to be more of a capsule shape, but a tablet form. And then we've got a lozenge and a troche. So those are some of the other tablet forms that you're going to be seeing. Now, a capsule is a shell, and it comes in a couple different ways. Usually it's a one-piece shell with liquid inside or a two-piece shell with some sort of powder or granules inside. A lot of companies are getting away from that two-piece especially. And if it's been many, many years ago, but if you remember anything at all about the Tylenol scare back in, I believe it was the 90s or the 80s, I don't know, I'm showing my age, but it was quite a while ago where they talked about where it actually happened where someone tampered with bottles and was able to get things into those capsules because they came into two pieces. So, you can see right here how you could take them apart and you can see the different pieces inside of it. So that's a two-part capsule. The other type is the shell where you have the liquid inside. Another drug form is ointment. An ointment has an oil base to it. Usually it is something that we apply to a specific area. One of the common prescription ointments that you're going to be dealing with is nitroglycerin ointment. On the other hand, we also have creams, and a cream has got a water base. So that's going to be absorbed into the skin, whereas an ointment isn't necessarily going to absorb well. We have a lotion, which has a water base as well, and it's considered a suspension. We have powders. A lot of times those powders are within a capsule, but we also have powders in IV form, where we're going to have to reconstitute it. In other words, we're going to have to mix it with something to bring it to a liquid state. We have some powders that we can sprinkle. We have powders that can be inhaled. So there's several different types of those. We have liquids. A liquid is anything that's considered to be aqueous or viscous, thick, non-watery, whereas aqueous is watery. And these are just some examples. Here is an ampule. An ampule is going to contain a liquid. And there's a special way to break an ampule, and this kind of goes through and talks about how to break it. But you can see that there's a little bitty line right here. And that line is kind of a natural break. So the amp will actually break off right there. Once we open an amp, though, we can't reuse it. This, however, is a vial, and some of these vials are multi-use and some are single-use. So this particular drug is atropine, and this is a multi-dose vial. And the reason I know that is because it says it right here. It's a multiple dose vial. If it was not intended to be used for more than one time, it would say single dose vial up here. And then we have liquids that come that are oral liquids. We have elixirs, syrups, tinctures, liquid sprays, foams, and mousse, and all of this has to do with consistency and the vehicle that they are in. Are they in an alcohol base? Are they in a water base? Things like that. This is an example of an elixir. You can see right here that it does contain alcohol, which is what makes it an elixir. And this is a specific one that is used for pediatric patients. And you can see that they have even a little picture of what the syringe is going to look like. It's an oral syringe, and they're going to, show you where to, draw it up to and things like that. There's a lot of information about suspensions in here. Here is an example of a suspension. This is one that comes in powdered form, and we have to actually mix it with water to create the suspension. On this particular drug label, you can see right here in the dark, it tells you to add 15 mils of water to the bottle, and then you will have your suspension. So just, another little difference. Couple other drug forms that you're going to see. The suppositories. Suppositories are not just rectal. You can also have vaginal suppositories, urethral suppositories. We can also have suppositories that are used specifically for children. A transdermal patch is a patch that we actually apply to the skin. Nitroglycerin is a really common transdermal patch. We have pellets, beads, wafers, anything that we're going to put inside the body. And then, of course, we have our inhaled gases that are typically things that we use in anesthesia. That's most likely where you're going to see those. So as you go through these slides, if you have any problems or questions about these drug forms, please make sure you reach out to me. My number is 618-792-2293. Have a great week.